Let us discuss breast. Now, breast tissue actually is discussed in detail in the surgery part, but of course we need to discuss the breast from basic anatomy point of view. So what is the extent of the breast? We can see from the second rib to the sixth rib is the vertical extent. About the horizontal extent, it is from the lateral sternal border to the mid axillary line. So this is the extent of the breast. So let us write down about the extent of the breast. So this is the breast tissue, and what is the extent? It is also called as mammary gland. Extent, when you say, it is from the second rib to sixth rib, that is the vertical extent, and from the lateral sternal border to mid axillary line, right? So these are the vertical and the horizontal extent. So now let us discuss about the blood supply. After the extent, blood supply and the lymphatic drainage are also important for the breast tissue. So when you see the blood supply, this is the schematic diagram, and try and understand this part, that this is the sternum and this is the breast tissue, and here this artery is the axillary artery. What is this artery? Is the axillary artery, and we have already learned the branches of the axillary artery. We know this is superior thoracic artery, this is acromiothoracic artery, this is lateral thoracic artery. We have a mnemonic also, short SPA, and this is the subscapular artery. So basically we can say axillary artery, all the branches except from the humeral arteries are supplying the breast, and they are supplying from the lateral aspect majorly. So that is why they are called as lateral mammary branches. That is why they are called as lateral mammary arteries. And here in this position you have the parasternal position, that is internal thoracic artery. Internal thoracic artery is giving these branches in the second to fourth intercostal space. In the second to fourth intercostal space, these branches are the medial mammary branches, which are the branches from the internal thoracic artery. And when you look at the breast position, it is present at the chest wall, right, in the subcutaneous tissue. So deep to the subcutaneous tissue we have the muscular part here, and we have the bony part here. Bony part is the intercostal spaces. In the intercostal spaces we have the arteries, intercostal arteries. Those arteries will give the blood supply to the breast tissue, which is lying superficially. So these arteries are actually coming from the deeper aspect, from the bony part, in between the bony parts. So that is why these are called as deep arteries, which are where these arteries are. So if I give this arteries as dotted, these arteries are actually posterior intercostal artery branches, which are supplying from the deeper aspect. Those are not the major source here, they are minor source, but yes, it is there. So what is these arteries? These arteries are posterior intercostal arteries. These arteries are posterior intercostal arteries. Again, in which space? Second to fourth intercostal space. So second to fourth intercostal space is common for the medial mammary and the posterior intercostal artery. In these spaces only they are getting these branches. So this is about the blood supply of the breast tissue. Now, as I said, along with the blood supply, the lymphatic drainage is also very important. So what is the lymphatic drainage? If you talk about the lymphatic drainage in any tissue, when we don't remember the lymphatic drainage as such, but if we have a fair idea of the blood supply, we can have a calculated guess for the lymphatic drainage. For example, here in the breast tissue, we can say that this is the sternum, this is the breast tissue, and the major artery which was supplying the blood to the breast was axillary artery. So here we can say the lymph will be going to the axillary lymph nodes only. So the major lymph will be going to the axillary lymph node. In the axillary lymph node we further have anterior, posterior, central, apical. All those lymph nodes, they belong to axillary group only. Fine. Also, if you remember the blood supply, here we have drawn the internal thoracic artery which was giving the parasternal, you can say the medial mammary branches. So here you have this lymph node. This lymph node is the parasternal lymph node. Parasternal because of the position, and from medial aspect the lymph will be coming to the parasternal lymph node. And this is important to understand, because if the malignant cells are moving across this through this lymphatic part here, via this route they can reach the opposite side breast also. That means the unilateral carcinoma can become bilateral via this route. Okay, and also we have to understand that this quadrant, particularly lower and inner quadrant, okay, lower and inner quadrant, this part particularly is draining to make one plexus. What is the name of the plexus? That is subperitoneal plexus. That is subperitoneal plexus. And from this plexus, if the malignant cells reach this plexus, from this plexus the malignant cells will include the other organ. They can create the secondaries in other organs. For example, the secondaries in ovary is commonly observed. The secondaries in ovary is commonly observed. What is that called as? Krukenberg's tumor. So what is that called as? Krukenberg's tumor. Right? So that is important information about the lymph. Also we have to understand that the lymphatics, when you say superficial lymphatics, will be actually draining skin, but it will not be draining the nipple and areola. So it will be draining the skin except nipple and areola. And the deep lymphatics will be draining the parenchyma plus nipple and areola. So the take home message, nipple and areola along with the parenchyma are drained into the deep lymphatics. That is the thing. Although the position is at the skin level, they are not drained into the superficial lymphatics. That is what is the meaning here, right? Now sometimes the questions are framed that if the malignant cell infiltrate lactiferous duct, what will happen? Or if they infiltrate the subdermal lymphatics, what will happen? So let us write down that information about the infiltration. See, if I say if malignant cell infiltrate, if the malignant cells infiltrate ligament of Cooper, then there will be fixation of the tissue, because normally the breast tissue is mobile in all the direction, but then if the ligament of Cooper are involved in that particular part, the tissue will become fixed and tissue will become hard also. And if the malignant cells are going to infiltrate the lactiferous duct, now we know the lactiferous ducts, they open beneath the nipple and areola part. So if the lactiferous duct are shortened because of the infiltration by the malignant cells, it will lead to what? Retraction of nipple. It will lead to retraction of nipple. Then if malignant cells, they infiltrate the subdermal lymphatics, subdermal lymphatics, then it will lead to peau d'orange appearance. It will lead to peau d'orange appearance, right? So that is what we have to understand in the breast.